As I enter, I just think that I did not belong here.
No, don't feel like that.
Anxiety, OCDs, there are a lot of people trying to like affiliate themselves with.
Last
It's
season.
like you are depressed now. Maybe they broke your heart, and then you now want to go and drink alcohol. The problem is
People struggle to actually understand. This is supposed to be a very serious video, but we're allowed.
Talking to self.
For almost everything I do, there's a definition for it. Fourth week of mental health. One more week to go.
Exactly. Have you seen it?
my network is bad.
Yes, please. Let me note down the questions that we have. Oh yeah, continue. Abel.
So group therapy is aimed at, I think you understand me. But group therapy is aimed at teaching problem solving and communication skills to the patient. Then for family therapy, that's
You said group therapy for problem solving and communication skills.
Yeah. But for family therapy, this one you give it apart from the psychoeducation. Psychoeducation is basically educating the patient about the illness and its cause and other stuff. But for family therapy, you are teaching the family how to relate with that person so that they don't maybe give so much high expressed emotion like hostility or how will I put it? Giving excessive warmth. So you get, they will teach them how to communicate.
So what are the is it 4 highly expressed emotions? Is it 4 or 3? What are the 3 highly expressed? Emotional over-involvement, hostility, critical comment.
Yeah.
I actually want to ask a question. You mentioned that the first line of treatment I'll be giving them is this one you're talking about. Why is this coming first rather than like the treatment for the patients? Maybe the aspect of pharmacology, yes.
Usually pharmacotherapy is how do I put it? It's like you are depressed now, maybe they broke your heart, and then you now want to go and drink alcohol. The underlying problem is still there. The alcohol is just giving you temporary this thing.
It's just
First working on the environment of that person would help in and you now give pharmacotherapy when it's now maybe severe or psychosocial treatment is not enough. Just supporting.
That makes sense. So we are done with Bruno. So who is going next?
You know, to something. My question is not skills. It's NMS.
NMS, that's the general district. Suicide body you guys.
Yes, but me I'm not here.
It's a psychiatric emergency.
But me I'm not here.
But it's a medical emergency, but it's not psychiatric emergency. So that's why it's neuroleptic malignant syndrome. That's why
it's a topic on its own.
It was supposed to be under psychiatric emergency.
When I watch
It's our slide actually.
Our slide.
Men are wicked. Men are wicked.
It's not like men are wicked.
Because wait, I did this thing, packaged it, brought it for you. Now you're telling me it's our slide. It's my slide.
Your slide.
You're not supposed to say that outside. No.
That's my point.
Oh, baby.
I said.
Something I'm actually being appreciative.
Thank you. I did not sit in that light.
Who has to go next?
Your notes.
As I enter, I just think that I did not belong here.
No, don't feel like that.
I don't belong here. Yeah, I'm sharing my own baby. So can I go that one?
It's my last day in mental health, and the plan I had before I started this process was I was going to make videos and record moments in mental health, but this is the least I will ever make videos. I guess I was still settling in. But yeah, plans have changed. I'm not going to be making moments or posting videos about moments in mental health. but rather much on what I learned while I was in mental health, and I think you should know about. So the first one will be that when people hear of mental health, what things that come to your mind is insanity or usual behaviour that a lot of people stigmatize about a lot. But over time being here, I have realized that there's so much more that happens that mental health condition, take likes of depression, anxiety, OCDs that a lot of people try to like affiliate themselves with, many others, even eating disorders, and a whole lot more that actually happen a whole lot in our community. And one of the beautiful things about this thing is that they can be managed. Yes, they can be managed. So yes, remove your mind that mental health is just about insanity or usual behaviors that cannot be associated with. Another one also will be the unusual behaviors that a lot of people struggle to actually understand. It's supposed to be a very serious video, but we are loud.
Talking to self.
So another one of it to be the unusual behaviors a lot of people actually struggle to understand, and it's one of the things that I found very fascinating, that these unusual behaviors, like people talking to self, saying they are seeing things that people are not seeing, that a lot of people are so worried about. The fact that mental health gets to actually like understand what these people are actually going through, put an explanation to it, and also be able to manage them in a way from like what they are going through. It's one of the most fascinating things that I've seen, that these things are not just unusual. There's like an explanation for it, and from this explanation gotten from them, they can be managed and be taken care of. It's just one of the beauty of medicine, that regardless of whatever it is that you might be going through, these have an explanation and can actually be managed. The other one will be about suicide. A lot of people struggle to talk about suicide. They realize that a person has been behaving a certain way, and they realize that and they think that probably this person might be thinking of committing suicide, but because this topic feels like a very sacred topic that you should not talk about, they don't talk about it until it happens, which is when a lot of people now speak about don't commit suicide and all that. Well, talking to someone who you feel like have been giving symptoms that are related to suicide does not mean you are suggesting suicide to them. In a way, actually it helps them, because when you talk to them and ask if they've been having suicide thoughts or intention, they get to actually like open up, and you get to know how to help them. If they need to refer to a specialist, to a doctor, or even the thing they are going through that is making them think of suicide, you get to actually be able to address them. So let's not shy away from talking about suicide or asking people that question if they've been thinking about committing suicide. Another very important one I noticed was about substance. I feel like it's a whole lot there. A lot of people still don't know about substance, and talking about like alcohol, cannabis, cigarette and all. Yes, a lot of people take it just for relief, to enjoy, for playing. But when you become dependent on it, you need a bigger dose, and like the effect you get from the ones you were taking before is not giving you again, it's not giving you the effect like before. There's a problem. And when you started and you are dependent and now like tolerant of it becomes very difficult to actually break free. And a lot of mental health conditions, if you come to it, I was one of the one of the first questions you always ask is, do you take substance? And that's because it's one of the leading causes, can be one of the causes of the things that are happening in mental health. And not just mental health, even medical conditions, that is the ones that in other departments like cardiac issues, liver issues, a whole lot. So yeah, there's a whole lot to be said, and I feel like a lot of people should really, if they want to help themselves, stay away from substance, because when you are in, it's become very difficult to actually like break free. And the last thing I will be talking about to be that these unusual behaviors that we see in people, this mental health issue, one of the things that can actually help people deal with it very well is social support. If they have a lot of family, friends being around them, being of help to them, they actually get a very good prognosis, that they get to actually like go back to their normal functioning. But when they do not have any social support, like family and friends that are supporting them, it's becomes very difficult for them to actually like go back to their normal functioning and return back to their former state. So yes, stigmatization goes a long way. So yeah, for almost everything I do, there's a definition for it, and yes, it can be managed. Hi guys, Tala is mental health, and we just finished our end of posting examination. It went well.
I had this pray for me, shall pass it.
Yes.
Okay, so it was a very, very interesting ride. So
actually, mental health was
it was beautiful. My skincare.
You know,